Hello, I am Jayaprakash Narayan, interacting with you in AskJP. Let's see Bhavya's question. Bhavya?
Hello, sir. My name is Bhavya and I'm a public policy professional from New Delhi. My question is specifically about healthcare. So, what do you perceive as the ideal role of the state versus role of the private sector being for a good healthcare ecosystem in India? And also the fact that health being a state subject, but a lot of key schemes, including, say, the National Rural Health Mission, the National Health Policy, Ayushman Bharat, all being very centralized and designed by the center, and also intergovernmental transfers being required to meet healthcare requirements at the state level. What are your thoughts, and what do you think is the ideal balance between center and state versus role of state and private sector?
Thank you, Bhavya, for this very important question. There is no ideal healthcare system anywhere in the world. We have to apply it to the context, whatever ideas we have in mind. I've always held that in a modern nation state, healthcare should be primarily the responsibility of the Indian government or the government. Because what should the government perform? The collective services and goods that we cannot individually provide for ourselves. And that is rule of law, apart from defense and other obvious things, in which there has to be an absolute state monopoly. Rule of law, that means public order, justice, and equal treatment of all citizens and law being above everybody else. The second is infrastructure. It has to be necessarily collective. Even if private sector delivers, the state has to take the responsibility of making it happen and in a substantial measure funding it. The roads, the ports, the basic infrastructure, the transport sector, or the electricity sector. Even if the consumer pays, in case of electricity, it's the state that has to provide the architecture and the basic infrastructure and the foundations. Then, if that's all the state does, it's not enough, because what about creating opportunity for everybody? What about harnessing the human talents in order to be productive, in order for the economy to grow and create employment and generate incomes and eliminate poverty? If the state does not play a proactive and effective role in education and healthcare, then the birth determines the future of a child. It's not only unfair and unjust, but it's also inefficient, because 80% of the gene pool is wasted for want of means. And therefore, modern governments have embraced the idea of education, universal education, particularly at the school level, quality education, and quality healthcare acceptable and accessible to everybody. These are the minimal functions of a modern state. Now, in India, unfortunately, in healthcare, the state has bungled very badly. Probably among large countries, the state's role in healthcare is lowest in India. The state accounts for only about 30% or so of the expenditure on healthcare in the country. In that, again, about 30% of 30% is roughly by the union government. The balance 70% is by the states. The states are funding entirely, the balance 70%. We cannot change it overnight, even if we wish to. Therefore, we have to accept this broad reality of a large private sector and the predominance of the state as the province in management of healthcare. But we should at the same time not ignore the union's role. Because unless there is an overall architecture for healthcare in the country to ensure reasonable quality everywhere in the country, that is equity among the provinces of the country, and the second is uniformity and standardization. Unless there is somebody at the national level, union level, to bring all the expertise and talent, there will not be uniformity of quality to meet the global standards. And unless you bring the economies of scale in a variety of sectors like vaccine procurement and a whole lot of other things, if each state wants to do it independently, then there will be many inefficiencies. And therefore, the union has to play an important role in creating the architecture. And that's what some of the so-called centrally sponsored schemes are about. The National Health Mission I was the architect of the National Rural Health Mission as a part of the NAC. It is a very small component of what ought to happen. We actually wanted a much bigger thing of universal healthcare system. But the political executive was prepared only to do up to a point, and therefore we had to be satisfied with the National Health Mission. So, given that, I believe that the state has to play a preeminent role in a modern society to provide quality healthcare to every citizen. That means your absence of means should not undermine your capacity to get health. Health must be available to everybody, at least reasonable quality of health across the whole spectrum and to the whole society. Because to my mind, the greatest sin in a society is avoidable suffering. If people suffer for want of money and access to health care, if they suffer needlessly in terms of premature death or long pain and suffering, prolonged pain and suffering, or sickness and disease and morbidity and loss of income, it's a tragedy. About 50 to 60 million people, 5 to 6 crore people, are descending into poverty every year in this country on account of lack of access to health care, lack of means, either because they could not earn during the illness, which is preventable or avoidable, or the morbidity, the period of sickness could have been minimized with proper healthcare system, or because they don't have the money and therefore they had to borrow or sell their assets. Either way, they're becoming poor, and they were not poor at the beginning of the year. The single biggest cause of impoverishment in India is failure of healthcare system. And therefore, the state has to play a proactive and preeminent role. And as I said before, while the states must take care of the management of healthcare, the overall architecture, some amount of funding and some nudging, and some critical functions in terms of quality control and setting the standards and some procurement issues, they must be dealt with at the national level. Now, what should the private sector do? We already have a large private sector, and private sector is doing a remarkably good job. We all complain about private sector in general, but we forget the things that they are doing in the absence of the state's capacity to deliver. When Indian state has spectacularly failed, it's the private sector that has guaranteed some modicum of health care available to the people in this country at a relatively low cost. First of all, take the pharma and vaccine sector. India is a world champion in both. In bulk, we probably produce the largest quantity in the world at the lowest price to meet the global standards. The moment Indian pharma sector entered the global markets in terms of, let's say, ART therapy for AIDS, the global prices of these drugs plummeted. And our drugs probably saved about millions of people, tens of millions of people from sheer death. That's just one example of what Indian pharma industry is able to do within the country and abroad. We produce high quality drugs at a relatively low price, one of the lowest prices in the world. Indian people are so poor that even these prices are sometimes seen as very high. But if you take by global standards, the drug prices in India are among the lowest, without compromising on the quality. Then take hospitals. India is the biggest destination of private investment in healthcare sector, amazingly, mostly in tertiary care hospitals. Modern tertiary care is very expensive. It's highly technology intensive. And even a single machine may cost a few $1 million each. And doctors, highly skilled, highly trained doctors, they take years and decades of intense work, hard work, and patience. Enormously stressful jobs, doctors, nurses, physiotherapists, pharmacists, nurses, others. Healthcare is an extremely complicated thing, and where there's very little room for errors. Therefore, you have to have the best quality people, and they must be rewarded adequately. And the maintenance and the cost of drugs and interventions and procedures, these are extremely expensive if you want quality care. Private sector is doing a remarkably good job. Today in India, roughly about 1 million people, overseas patients, they're coming to India to get treatments, high-end treatment in India, providing us about $13 to $14 billion of foreign exchange. This can easily rise to about $100 billion in the next 7 or 8 years. We have the capacity. If we improve some standards and nursing and and ensure that the foreigners have greater confidence in our healthcare delivery system, because we provide cutting-edge interventions at the lowest cost in the world. Not every intervention, but many interventions. We must leverage them because global healthcare costs are skyrocketing. Healthcare also is a tremendous job provider. In India, we only employ about 3 million people, roughly, in healthcare sector, in government and private sector put together. You compare to other countries, United States, with a population of 1/3 of ours, it employs about 10 million people in healthcare. Britain, with a population of just about 64 million people, it employs about 1.6 million people, mostly in government NHS, but some in private sector also. Relative to that, India is employing a very small number. Even if we can quadruple this number, which is eminently easy if you provide decent healthcare delivery to the people of this country, poverty will diminish, productivity will go up, the quality of life will improve, and we'll create employment to at least about 10 to 12 million people in addition to the people we're employing. So it's an economic issue. It's also stimulus of the economy. That's the way we should look at healthcare in the country. So private sector is needed in order to be able to harness the opportunities, in order to go for cutting-edge technologies and cutting-edge interventions and providing global health to the global population and earning foreign exchange and creating jobs. But private sector also is needed for public-private partnership. While the heart of the healthcare should be government-driven, government-funded, so that there is no out-of-pocket expenditure for the people, it will not be effective through government institutions alone or through bureaucratic methods alone. The two hallmarks of improvement of any public service are competition, choice. If there's no competition among the healthcare providers, there's no incentive to excel. If there's no choice to the patient as to which doctor to go to or which hospital to go to, then there's no satisfaction for the patient and there is no accountability. Therefore, without choice and competition, merely expanding the government healthcare system, spending more money, hiring more people is good, necessary, but not sufficient. So this public-private partnership, judicious partnership is very important. You take, for instance, the case of Ayushman Bharat. What started off as Arogyasri in the then Andhra Pradesh, now AP and Telangana. And some states, AP, Telangana and Tamil Nadu, are doing a very good job of implementing that, for instance. It has now become a national program of Ayushman Bharat. The critical issue there is the patient has a right to go to any provider within the list of providers approved by the government, public sector or private sector. There is competition. The costs are controlled. We have to obviously improve that and make it universal, etc. But the basic model is a very wise one. Therefore, even where the public sector has to take the primary responsibility of delivery and access to health care, the private sector has a critical role to play to ensure quality and accountability. Now, what is the best way to go about it now in the country? World over, healthcare is a very costly issue. America spends about 18% of GDP, half of it by the government, through government-funded programs like Medicare, Medicaid, and Veterans Care, and so on and so forth. Half of it private sector through insurance. Now, insurance is necessary. It essentially pools the risks. In catastrophic illness, it protects us. But insurance cannot be a universal program in a country where 90% of people are in the unorganized sector, where there's no monthly regular wage. We must remember that India is unique among large economies. About 90% of people are in the unorganized sector without a security of a regular job, oftentimes with low skills and low incomes. Without a regular employer and employer-employee relationship in the organized sector, insurance has never worked anywhere in the world. And even then, insurance has inherent limitations. There are many market failures in insurance. I don't want to go into the details of economic theory and analysis, but it is obvious that the patient's concern is about his or her health, no matter what the cost. Insurance companies' concern is to maximize the profit and minimize the claims and payments, no matter what is the outcome. And therefore, a lot of money goes towards administration, sometimes denying insurance coverage. And the better off patients, more informed patients, they are likely to avail services better because they are smarter. The poorer patients, less informed patients, they don't really have that luxury. They go only when there's an emergency. There's tremendous asymmetry of information. There are moral hazards of all kinds. So insurance, while it's necessary, it will not work beyond a point. Therefore, insurance as the mainstay of healthcare is in a large measure a pipe dream in a country like India. Look at the numbers. About a year or two ago, I don't know the latest numbers, but they can't be radically different. If the total insurance premiums paid in the country in a year are about 30,000 crores, roughly of that order, the claims are about 16 to 17,000 crores, about 60% or less. Now, 30,000 crores in an economy where the total health expenditure is probably of the order of about 9 lakh crores. Again, the numbers are not very clear. Every other day, the government and the government agencies come up with a slightly different number, but generally it's believed that about 4.2 or 4.3% of the GDP is the expenditure on healthcare in India, of which about 1.1, 1.2% is by the governments, union and state. The balance 3.5% is by the private sector. Out of the 9 lakh crores, insurance today accounts for only about 3% or so. So to believe that insurance will be the mainstay, I'm talking about a private insurance, not publicly funded risk pooling. I'm talking of private insurance. If insurance is the mainstay, that simply is not going to happen in India. And perhaps it's not even desirable going with the American experience. We have to move towards some kind of universal healthcare system in the country, where the primary care, apart from the public health and vaccination and nutrition and maternal child care, which government is trying to provide, and we have to improve that apart, the doctor-patient contact, the family care, the first point of contact. Then the secondary care, I would call it secondary care if it's the first point of contact to a hospital. Tertiary care, where much more sophisticated multidisciplinary interventions are required. So if you take all these three sectors, government must be able to provide end-to-end care to all people. And wherever it is feasible to provide the care through private sector in addition to public sector, it must be based on competition and choice. And that means you must have a pool of primary care physicians acting as family physicians in a small town within a defined geography. And the people must have the choice of deciding which doctor they want as their primary care physician. And the doctor's remuneration or reward must depend on the number of patients the doctor attracts. It is a variant of the model Britain has adopted in NHS at the primary care level. But the funding is entirely from the government, with diagnostics and prescription drugs being added. Already there is a procurement program, centralized procurement in many states in the country. Tamil Nadu has done a very good job. Other states are imitating. We can do it across the country at a relatively low cost. And diagnostics, there is a Government of India program. Only Andhra Pradesh has done a very good job of implementing that across the state, a free diagnostics program. We can adapt that, improve that, universalize that. So already there are models available. So first point of contact is primary care, how to improve. Without that, if you only focus on hospitals, hospitals in India are overcrowded. All India Institute of Medical Sciences, Delhi, gets about 12,000 outpatients a day. Must be a world record. It's not a source of pride. It indicates the failure of the healthcare delivery system. Because there is no first point of contact that is reliable and trustworthy for the people, people tend to go to high-end hospitals for simple problems, which ought to have been addressed at the primary care level. So, very costly, very highly skilled tertiary care facilities, we're utilizing them largely for primary care needs because of the very distorted system, dysfunctional system. That's not the way it should run. So, primary care is the foundation. It must take care of 80% of the problems. It must monitor on a long-term basis many chronic diseases like high blood pressure, blood sugar, diabetes, heart disease, and many other things. For everything, it must not be a high-end, multi-speciality, tertiary care institution as a point of contact. Primary care is also necessary to ensure that patients don't have to go to high-end hospitals overnight. Without a referral, unless there's an emergency, they don't have to go there. So you have proper utilization of resources and best outcomes possible for the people at the lowest cost. That is the first thing. The second level, the first level hospital contact, what I would call secondary care. That means most of the interventions are the hospital-based interventions, but not very sophisticated and costly interventions. We'll exclude some of them. For instance, cancers. For instance, heart surgery, coronary bypass and other surgeries. Knee replacement and polytrauma. And some other very complicated problems, kidney disease. These are all tertiary care problems. Today, in the Ayushman Bharat at the national level or the Aarogyasri or equivalents at the state level, wherever data is available, Andhra Pradesh and Tamil Nadu have very good granular data. 50% of the total money spent is going to 4 interventions: cancers, heart disease, or kidney problems, knee replacement, and polytrauma. These are tertiary care problems, whereas the secondary care problems, almost everything else except the high-end interventions must be addressed free of cost to the patients, without any discrimination, on a universal basis, utilizing both the public sector and private sector. In other words, it's an improvement of the present model of Ayushman Bharat and Aarogyasri, but with adequate funding, covering almost all interventions required except the very high-end costly tertiary care interventions, and with universal coverage of all the people. Given India's class structure, about 30% of people probably will never utilize government facilities or government-funded facilities. Does not matter. If a service is only for the poor, over a period of time, the service becomes very poor because there's no voice. There will be no accountability over time. We require at least some of these middle classes to utilize these facilities so that the voice is there. The system will respond. The quality will be maintained. In any case, healthcare, if we accept it as the primary responsibility of the government, every taxpayer is entitled to utilize this from the public sector without out-of-pocket expenditure. That's what happens in Britain and many other countries. Canada, for instance, many other countries. Your means should not be a criterion. Rich or poor, you must be able to avail that. As I said, given India's class structure, probably 100% of people of India will never utilize the publicly funded healthcare system. But even if 30% don't utilize it, making it universal makes sense in order to ensure the quality. And if 30% spend their own money through insurance and other means, to that extent the burden on the public sector is reduced. So it's a win-win for everybody. But it must be universal in scope and covering practically everything except the high-end, high-cost tertiary care interventions, where there is no end to perfection. The cost will escalate dramatically with the benefit not commensurately improving. And therefore, there must be some kind of a careful assessment of what intervention is needed when. Otherwise, modern healthcare can simply jack up the cost dramatically without improving the healthcare outcomes. We must never confuse between high expenditure and better outcomes. America, as I said before, spends 18% of GDP on healthcare, but America is ranked only about 30th or 35th in the world in terms of healthcare outcomes. It's actually at the bottom of the OECD countries. Whereas countries that spend about 8 or 9% are doing much better than America. We are doing only 1% or 1.2% from government, union and states together, another 3.5% from the private sector, ours at 4.5%. If the government spends merely another 0.5% to 1% of GDP, over and above what we are spending, but spend wisely, we can create a pretty good healthcare delivery system, universal system, across the whole spectrum. The tertiary care, I would urge, take the old teaching hospitals, there are 147 of them. There are many more new teaching hospitals that came about. There's mushrooming of hospitals without adequate infrastructure. But the old hospitals, 147 medical schools, government medical schools, with 1,000 beds or more in each of these cases, they're all reasonably well-established institutions. But they are underfunded, hopelessly underfunded. In the private sector tertiary care, the capital cost of a bed, per bed if you take it, it costs about 1 crore to 2 crores to establish the hospital. And the annual billing in these hospitals ranges at the low end at about 60 lakhs, 70 lakhs per bed per year to 1.5 crores, sometimes even 2 crores per bed per year. In most of the state-run hospitals, teaching hospitals, how much is the government spending? About 10 lakh rupees per bed per year, including everything, including medical education, nursing education, a whole lot of other things. Obviously, this simply is inadequate in modern medicine. Tertiary care is costly. We have to significantly improve this over a period of time. You can't afford to spend 1 crore per bed, but we must go up to 25-30 lakhs per bed on average. I'm not talking of R&D institute, I'm talking of the bulk of the publicly funded teaching hospitals in India, which are hopelessly underfunded. So 25-30 lakhs, progressively increasing it, and very innovative programs to improve the infrastructure so that the capital investment one time will not be much. You can encourage the private sector to establish some of the facilities and also have the pooled diagnostics, very high cost diagnostics, so that the cost can be controlled, utilization is better. There are a lot of innovations. And then bring in the best private sector specialists to serve in the teaching hospitals as honorary teachers, etc., so that you can attract the patients and you can have better quality teaching. So you can do a lot of things, but to put a number in terms of money, maybe 25-30 lakhs on an average per bed is the minimum expenditure required. All these three together, the family care system across the country with competition and choice, the expansion and improvement of the secondary care system, the Ayushman Bharat Arogyasri model, to all the population and to almost all interventions, excluding the high-end tertiary care interventions. And three, improving the high-end tertiary care, but free of cost to people. These three together will probably cost about 1 trillion rupees per year, 100,000 crores per year. And that comes to less than 0.5% of the GDP. In a country which is spending the lowest amount among significant countries in terms of healthcare, this is nothing. For decades, Indian governments have been offering 2 to 3% of GDP as the public expenditure on healthcare. But we've stagnated 1.1, 1.2% for the past 30 years at least, probably 40, 45 years. This simply is not right. We can easily do remarkably well. It will reduce poverty. Imagine these 5 to 6 crore people not descending into poverty every year. Without any other intervention, we can eliminate poverty in the next few years. It will enhance productivity. A whole lot of people are not able to work even when there is employment available, particularly in the low-skilled, hard-working sectors, because of illness. It will, of course, improve the quality of life, prolong lives, and eliminate avoidable suffering. This is the best investment for economy, to eliminate poverty, and to improve the quality of life in the country. We are privileged as a country, despite all our problems, at a relatively low cost. India is capable of providing all this. If in any other country you say you add 0.5% of expenditure and you'll have dramatic improvement in healthcare, it will be insane. In India, we're privileged. And if the country can afford it, we can look at more expenditure. Right now, we have serious fiscal constraints in the country. Therefore, there's no point asking for the moon. But 100,000 crores with all the benefits and vast employment generated on account of that is not asking for something unreasonable. It's very much affordable. It doesn't have to happen one day. You can take a 3-year program, phased improvement, scaling it up. But that's the minimum required, but in the right manner, in order to provide decent health care. And once that happens, the political will, the public demand, and of course the economic growth, which we're hoping in the next few years it will be 7-8% in the next decade or two, all those give us greater fiscal room to further improve healthcare and spare more money. But at this point in time, this is the absolute minimum that we require to spend, but in the right way, to give a decent quality healthcare accessible to everybody and to eliminate avoidable poverty and pain and improve productivity and improve quality of life. I hope you, the bright young people looking at public policy, you look at the detail. We require smart ways of doing things, not merely imitating America or some other country. We have a unique situation. Very large private sector, very low public expenditure, extremely poor population, vast morbidity, and descent into poverty. So unless we have innovative models taking advantage of our strengths and public-private partnership, we cannot really do a good job. And we cannot ask for the moon. If I simply say, give me another 4% GDP for healthcare, it's not going to happen for the next 30, 40 years. We have to innovate and find the best possible solution based on our own experience and the best practices in the world. And I believe we are privileged to be able to do that in India, if only we have the wisdom to see it. And let's hope that the political parties see the value of it in terms of the economy, in terms of societal well-being, and in terms of votes. I believe there are actually votes in elections on account of better health care. Some smart chief ministers who embraced EMRI 108, emergency response system, or Arogyashri and the present model of Ayushman Bharat and others, they realize that there is vote increasingly. World over, healthcare is one of the important vote getters or vote losers. In India, somehow we did not make education and healthcare real political issues. All extraneous, irrelevant, polarizing issues are becoming dominant instead of the real issues that affect the people's lives. But there are signs that healthcare is becoming more and more important in terms of political consciousness and voting preferences. And all of us, beyond parties, must take advantage of this opportunity and push for an affordable, a pragmatic healthcare delivery system available to everybody so that nobody suffers for want of healthcare because of an inability to afford it. There must not be any out-of-pocket expenditure on the poor. That's the minimum requirement, and there must be quality healthcare accessible to people. I think it's achievable if we join forces and raise voice collectively.